tuning in to another one of our video casts. This one's very interesting today. I think they're all interesting. Maybe you don't think so. I think so. Concussions, traumatic brain injury, TBI. You see this little terminology, TBI, or a patient or an individual had a TBI, traumatic brain injury, closed head trauma, concussion, God forbid an accident, soccer, contact, head-to-head, football. It's rampant. I don't even know what to say. I feel like it's off of the charts. Not so much the number of concussions and so on, but the aftermath, the trauma, the long-term complications. What are the long-term complications? Many cases, chronic headaches. I have a low-grade headache. I cannot concentrate, mom or dad, many times as an athlete or a young student. I can't take tests anymore. It seems as though when I have to focus or concentrate in tests, I'm overwhelmed. I have a difficulty with multiple sensory perception. Noises, lots of things going on. The phone's ringing, people are talking to me. Class, it's too much. Many individuals just struggling in this area today with post-traumatic brain injury, post-concussive syndrome, whatever you want to call it. Unfortunately, and I want to be somewhat black and white on this, medicine and the medical community, neurologists doing a wonderful job at doing the analysis, documenting whether or not you have a concussion, whether or not you have post-concussive syndrome. I'm not real sure we're doing a great job at enhancing movement forward or healing or reparation. Now, we can do things such as specific movement, eye movement type techniques. There are a lot of universities doing this, and that is improving and stimulating, kind of tracking the brain again and helping to stimulate natural neurogenesis. I think the key component that we're missing, obviously from a holistic and naturopathic standpoint, we're missing what is at the root of I'm just going to use this now, post-concussive syndromes, meaning after I've had the concussion, after the total brain or traumatic brain injury, what's happening 2 months later, 6 months later, 3 months, 3 weeks later? I'm still having problems, headaches, migraines. I can't think straight. I can't function. I'm anxious. I actually feel I'm getting depressed. I have not been able to recover. So we're doing things from the medical standpoint, but I don't know that we're doing things from a holistic and integrative standpoint to help move young people forward. So let me just read to you one little piece of information. I have tons. I did a lot of research on this, and I don't even know where to begin, but let me read you this. This is from a therapeutics conference talking about scenarios with brain injuries and so on. And it says here, chronic TBI patients had significantly lower circulating concentrations of numerous amino acids, as well as essential amino acids and large neutral amino acids. Considered as groups and displayed fundamentally altered cytokine, that's inflammatory, amino acid relationships. Many years after the injury, traumatic brain injury patients exhibit abnormal metabolic responses, altered relationship with circulating amino acids, inflammatory cytokines in the brain, and even hormones. The pattern is consistent with TBI, including chronic disease state in patients. In other words, indicating or now calling this a chronic disease state. The pattern is consistent. We see that inducing chronic disease state in patients, understanding the mechanisms of this chronic disease state, could lead to new treatments and prevention. Well, that's what we're all about. And that's what we want to cover today. Number one, what happens? What's at the root? Well, with traumatic brain injury, we often see that there's microglial activation. The glial cells in the brain are part of the brain's immune system. When they become traumatized or damaged, they literally kind of get set on fire. All right? They get set on fire. Basically, there's extreme activation, and at some point, the body does not know how to turn it off, hence creating singed, damaged neurons in the brain, damaged microglial cells, astrocytes, and we have what that leads to then is impaired neuronal health I can't think straight. I can't communicate. I don't make my neurotransmitters. My cognitive deficits are on the rise. Number 2, neuroinflammation. This ties to this, but neuro obviously meaning neurologic or nerve tissue. There's a chronic state of inflammation that if you do not suppress and quiet down, leads to chronic microglial activation, impaired repair. The neurons become singed. And so if you think of even the typical neuron in the brain and kind of what it looks like, this is a very poor representation. But within here, we have things like serotonin and dopamine and all these neurotransmitters, norepinephrine, epinephrine. But you see, they're conducted across these clefts. This is called the synaptic cleft. Well, business communication is conducted across these guys. If this is damaged, these neurons are singed and they're damaged and they're retracted and they're singed, I have lack of communication. Chronic neuroinflammation, chronic microglial activation after concussion. If it's not dealt with, it's almost impossible to repair and heal. Hypoperfusion. Often with a lot of this damage, there is low oxygen to the brain. This is where hyperbaric oxygen therapy and treatments can be very, very helpful. Nutrient deficits. You'll see, and I'll go through it, there's clearly nutrient deficits that ensue post-traumatic brain injury. Cellular, so at a cellular level, there's damage, kind of what we're talking about here. At a subcellular, at a mitochondrial level, glutathione issues, there's trauma, there's damage. And then even the structure, so microstructures are referring to things like this and things like the glia, right? The glial cells, the neurons, there's microstructural damage that takes place. Now, how do we begin to heal and repair? Unless I can restore some of this tissue, I cannot conduct business. I cannot conduct neurotransmitters. I can't send signals. I'm in a state of impairment, basically. Neurotransmitter deficits, kind of already covered that. There's often a link between this. My components of serotonin, dopamine, norepi, epi, etc. GABA. This is a biggie. GABA is a calming guy in the brain. Well, often GABA levels are diminished. They're traumatized. GABA produces a sense of calm. That's why in some TBI, there's discussion about using things like progesterone, because progesterone has a great calming effect to the brain, to the structures, and even affects GABA. Amino acids. Even in my research, I was unaware of this. I knew about all these other things, and I knew about some of these other nutrients, and I knew about this, and the one that was shocking to me, which I was totally unaware of, and I'm not real sure why, I don't know, but in the brain of laboratory animals that have had traumatic brain injuries, they can find clearly amino acid deficits in their brain. I'm not real sure why. I don't know if the trauma, there's greater utilization, and with the inflammation, there's an impairment. I don't know, this is purely speculation as to how the body now uses amino acids, or there's a greater need, and what you have on board is not enough to meet the need. I don't know. All I know is, stunning to me, but there are significant amino acid, large, we saw essential amino acids that are impaired. So what's the approach? You've got to do what you've got to do medically. You've got to do the I type therapies. You do all of the support and cognitive types of therapies. But I firmly believe if you do not integrate integrative medicine here, you're making a huge mistake with yourself, your loved one. It's a huge problem. Number one, D3 has been documented actually to be, D3 and omegas, if you have your youngster, your young athlete, on significant doses, anywhere from 2,000 to 5,000 units a day, and you have them on a quality EPA DHA supplement like the omega 800s, literature shows, I have it to back it up, that you can prevent some of the long-term deficits in trauma from post-concussive syndrome. Can we then use it therapeutically? Yes, you can. D3 is quickly aligning. I have an entire article, study piece, just on D3 alone and how D improves the repair of the brain post-trauma. Omega-3 fatty acids, DHA deficits in the neuronal structures at the synaptic areas, there's great depletion. When I can replete with essential fatty acids, I encourage repair. Number 3 about omegas is I reduce inflammation. This is a big, right? Neuroinflammation, microglial activation. What do the omegas do? They help to reduce the inflammatory response. Number 3, OptiMag Neuro. This is a new step for us. We always have been big on the right forms of magnesium, absorbable, cell cycle intermediate type magnesium forms, whether it's the aspartate, the citrate, the lysine, the bisglycinate, glycinate salts. Those are not all cell cycle intermediates, but they're all highly 100% bioavailable ionized forms of magnesium. Another form of magnesium, the L-threonate form, has been shown to cross the blood-brain barrier, get into the brain to a higher degree. So in this particular situation with your youngster or you, I'm going to make recommendations of high doses of D3, high doses of omega-3 800s, and OptiMag Neuro. Why not your Mag Essentials? Isn't it any good? It's awesome. But in this particular case, what I want to drive as much as I can through to the brain, I'm using OptiMag Neuro because of the L-threonate form. I'm going to use a prep called Brain Vibrance, GPC, glycerophosphocholene, acetyl L-carnitine, phosphatidylserine, B12, all showing benefit, especially out of some research out of Italy with stroke with the GPCs and phosphatidylserine. So when you think of this, you think of stroke, you have trauma to the brain, whether it was lack of blood flow or it was bleeding on the brain that traumatizes the brain. You still have some of the similar components, neuroinflammation, microglial activation. I have low oxygenation. I can then develop cellular and microstructural deficits, nutrient deficits. So the process post-stroke could actually technically be the same as far as nutrient, but we're talking about concussions here. Branch chain amino acids, why? Or just straight amino acid blends. I kind of maybe lean to this one more so. Why? Because of recent literature saying, it's not just about some of these other micronutrients. You find I've got significant amino acid deficits. Curcumin, and I use specific forms of curcumin that have enhanced characteristics for absorption. Article piece, now in the last couple of years, we know even in neurodegenerative disorders, but now specifically with post-concussive, reducing the inflammatory cascade. Antioxidant blends. I would want you or your significant other or your child to be on smoothies that have blackberries and blueberries. Your diet must consist of significant levels of antioxidants, colors, because antioxidants are quieting, if you will, to the inflammatory response. They quench free radicals, promote healing. The last component that I kind of did not list, what I would also use, depending upon the situation, would be something called omegagenics, specifically because this has an ingredient that mimics something that the body does, and they're called specialized pro-resolvin mediators. They help to downtick or send the right signaling to the brain in all parts of the body, not just to the brain, about how to begin to resolve the inflammatory process. Trauma to the brain triggers inflammation, microglial activation, neuroinflammation, depletion of oxygen to key tissues. Hence, now I'm using nutrients at a much higher rate. I have nutrient deficits. I have cellular and then larger structural damage that occurs. I got neurotransmitter deficits, GABA, norepi, serotonin, now showing amino acid impairments, and I'm sure we're going to find more as time goes on, and I have I mean, as I always say, I can't even tell you. I mean, things on zinc that I haven't even talked about here. But the whole key is don't just settle for just one single approach. You must be engaged. You've got to engage in nutrients, micronutrient structure that helps you to repair, encourage the process to go forward. God bless you. Thanks for being with us, and I hope this helps and blesses you or someone in your family. Be well.